Hi, students. I just want to explain the cultural competency plan assignment to you. Um, when you're working this assignment, you are going to want to, first of all, understand what the four parts of the cultural competency plan involve. The first one is policy, structure, practice, and then attitude. So you want those are what you will address in your policy. And so I'm going to explain those objectives for you. Policy is basically the procedure or administrative action is what you plan to do as it relates to culture. And this will provide guidelines related to the cultural interaction. So that's going to be your policy. It's like, what is your philosophy? What do you want the staff to do in regard to culture? And then the structure is how you will bring culture into your into your facility. I'm sorry. So with the structure, it's talking about your healthcare organization, whether it's a clinic, a hospital, is those things that you're going to do to help people from different cultures feel comfortable in your facility. So this might be having pictures up that represent the community you're serving, or you may have signs that have other languages other than English, as far as point patients in the right direction. So those types of things are going to be involved with structure. And then for practice, what will the staff be responsible for doing to address culture? So some examples would be, will they be able to speak other languages? Are you going to make sure you employ staff that speak different languages other than English, or maybe even other than Spanish? Some other examples would be, are you going to be able to have access to translators? And then undergoing training for various cultures. So when we talk about access to translators, sometimes that's just a matter of having a translator phone in an area where, if the providers or those working with the patient are unable to communicate with them with their language, then will they have easy access to trying to get that person with the right person to translate for them, so that communication doesn't become a big barrier. And then with attitude, this is what will be done to help make the staff more aware of various cultures. Some examples would be, are you going to test your staff to see like where they are, if they're biased in certain situations, or do they feel comfortable with certain cultures? Do they understand certain cultural backgrounds that might either impede or help facilitate care in your facility? And then we're going to talk about the cultural competency template, and I'm going to show you that in just a second. But on that template, which is what you're going to fill out, we do have an example in your assignment instructions, and I'll show you that. But the template involves having the overall objective, and this is going to address the goals of each objective that we just discussed a minute ago. And then there's going to be a part for measurement, and this should provide the instrument you'll be using to measure whether or not you're meeting those goals that we discussed. And then your strategy is the plan of action that will be taken to meet the goal. And then who's responsible? This will address who will be responsible for those goals being carried out, making sure they're carried out. And then how will this be monitored? And just to be clear, the Human Resource Department usually handles most of the things having to deal with employee training. And since cultural competency is more of a facility-wide initiative, HR normally takes that over, or if the department or the healthcare organization has a training group, a lot of times that training group falls under human resources as well. And then also the department managers or directors will also play a role in making sure that their staff is adhering to the policies, that they're trained, that they're able to ask questions immediately about certain things. So those would be the people who you would consider to be those who need to monitor the cultural competency plan in your facility. So here's the the template that you're going to fill out. And we talked about the policy, structure, practice, and attitude. You're going to do two objectives under each one. And then we talked about the measurement. So this is where you would put your measurement tool, the strategies, who's responsible, and how will it be monitored, or who will be monitoring it. And then lastly, one of the things that's going to help you to kind of understand culture, because I know that you're probably like, okay, so I got to do this assignment, but I don't actually understand what is involved in the cultural aspect of in trying to come up with a plan. So in your assignment, you're going to have a document called the National Standards for Culturally and Linguistically, I'm sorry about that, Appropriate Services, which is CLASS. And this is about becoming a cultural competent healthcare organization. And so this document is going to have some terms, some different things to kind of help you move along in understanding what you need to be looking for or adding to your cultural plan. So let me go into your assignment, and we're going to show those documents. So make sure you read everything about the background of your healthcare facility. So that's going to lead you in a way of what you need to pretty much focus on. And then these are the hyperlinks to the things that you'll need to review. So what I was just talking about, becoming a culturally competent healthcare organization, be sure to pay attention to the CLASS standards. And that's what I was referring to just a minute ago. So here, this is the pamphlet for that, becoming culturally competent. And you want to make sure that you read through all this information, because it's just going to give you a better understanding of culture and what is involved in it. That we talk about the social benefits, the health benefits, the business benefits of it. And then it also speaks of the community survey, community engagement, staff education, because when you're talking about being culturally competent, you definitely want to address the majority of the people that come into your facility. And so there may be a certain group of people that have a particular culture, one that you may or may not be familiar with, but you want to make sure that your team is familiar with that. And you want to make sure that if your community, the community in the area, your healthcare facility, has a different culture than the entire your organization per se, then you want to make sure that your staff is comfortable with that. And so here we talk about community engagement, staff education, excuse me, those types of things you want to read through and just kind of get an idea of what that would involve. And then it talks about the effect of cultural influences in clinical encounters. So just understanding, what pretty much makes this culture tick, what things are different that you'll need to kind of have your staff adjust to, so that you don't lose clients, and most of all, to make sure that the client or the patient is helped with the type of care that you are trying to provide them. So again, you'll just read through all this information, and then at the very last page is what I wanted to get to, is the National Standards for Culturally and Linguistically Appropriate Services in Health and Healthcare. So you'll read through these principles, and again, it's going to help you, like I said, better understand culture and what you might need to include in your plan. So nothing is word for word. It's just your idea of, okay, this is helping me to think a little bit further in terms of, what I want to use in terms of my policies, the structure, attitude, practice, those types of things. And then also in your assignment instructions, we have the review of the Region 3 Behavioral Services Cultural Competency Plan. And this is just an example of how they did their cultural plan. So if you scroll down, you'll see you'll have to fill out these same things: the policy, structural, practice, and then the attitude. Now, you are not to copy this word for word onto your template, but you want to use this to kind of help you to, understand what might you put here in regard to what you want to do. So that's what this is here for. It's just an example for you to use, but you want to use your own words and come up with your own policy. The other thing I didn't show you, it's not on this. The other thing that I need to show you is I want to make sure that you understand you need to answer another question on the policy. And let me close this out. That's going to be this one here. It says, answer this question: how do cultural issues affect health, healthcare quality, cost, and HIM? So you need to respond to all four parts of that question along with completing your cultural competency plan. If you have any questions or anything, just reach out to me and I'll try to answer any questions that you have. Thank you.